The Prospect study was designed as the largest and longest open-label multi-center study to evaluate the safety and efficacy of transcutaneous afferent pattern stimulation in adults with essential tremor. Statistically significant improvement was demonstrated in TETRAS physician-rated assessment, as well as the patient's rating of their activity of daily living during the 3 months of use. Participants used the wearable neuromodulation therapy at home twice per day and recorded their tremor symptoms directly on the device. The therapy used in the trial has 3 components: the stimulator, the band, and the charging base station. This therapy was cleared by the FDA in 2018 for symptomatic relief and was most recently studied in Prospect to understand the repeatability of effect over 3 months of use. Tremor amplitude is unique for each patient and progresses with age. The therapy used in the Prospect study analyzes each user's tremor amplitude and individualizes the stimulation pattern to disrupt their tremor. The Prospect study evaluated the safety and efficacy from transcutaneous afferent pattern stimulation over 3 months. At 3 separate visits, TETRAS and ADL evaluations were administered in adults with essential tremor. Motion sensor data was collected at each therapy session with the Cala Trio device. There were over 21,000 therapy sessions collected from patients. During the 3 months, physicians assessed tremor in the office with the TETRAS rating scale. TETRAS is a validated comprehensive rating scale for essential tremor. Clinicians were provided a standardized rating for 6 upper limb tasks. Statistically significant improvement was demonstrated in physician-rated TETRAS scores, as well as patient-rated activities of daily living. Improvements were seen within each office visit as well as across the 3-month study duration. The most significant improvements were demonstrated in handwriting, holding a cup, and eating with a spoon. 62% of patients with severe or moderate TETRAS scores improved to slight or mild tremors after 3 months of use, and 68% of patients with severe or moderate ADL scores improved to mild, suggesting these improvements in both clinician and patient ratings are clinically meaningful. The per-patient tremor power reduction of home use therapy sessions is plotted here. Each vertical bar represents a patient's tremor improvement in most sessions during 3 months of home use. Over 92% improved, while 54% experienced at least a 2-fold improvement, and 25% of patients experienced a greater than 70% reduction in tremor power. Essential tremor is a benign yet life-altering condition that impairs performing day-to-day activities. Results in the Prospect study suggest that tremor control is possible without systemic pharmacotherapies or invasive surgery. 85% of participants reported the device was convenient and easy to use. Participants currently on medications and not on medications responded equally well to therapy over 3 months. 64% of patients reported persistent tremor relief, lasting 94 minutes on average. A variety of metrics have now confirmed that transcutaneous pattern stimulation is effective and safe over a 3-month duration. The tremor reduction seen in this study is comparable to what is seen by first-line medications, such as propranolol and primidone, but with a more favorable side effect profile. The clinically significant results in the Prospect study were achieved with no device-related serious adverse events. Adverse events were primarily skin irritation and resolved without intervention by decreasing stimulation level with topical ointment or discontinuing therapy until resolved. Already, 3 clinical trials have demonstrated that the Cala therapeutic benefit is significant. Accelerometers in the device capture motion data before and after each stimulation session. In the Prospect study, a statistically significant response to therapy was demonstrated in objective accelerometer measures. In fact, over 21,000 stimulation sessions were collected and correlated with the gold standard TETRAS clinician ratings. By measuring and characterizing the tremors during real-world use, future of tremor assessment and management is now possible.